I'm traditionally trained. I went to a traditional nursing school, but I like to say I have more of a holistic approach. And that doesn't mean like voodoo medicine or anything like that. All that means is I look at the whole person. So we look at, and you'll hear it all the time, Jen talks about this wellness wheel, and every little cog is part of the wellness wheel. And it really is. I mean, it's everything from sleep to labs to diet to relationships to even sometimes your faith comes into play. So we're really looking at the whole person versus like a cardiologist is like here to here, and a GYN is here to here, and that's really like what their focus is. But in our office, say you have a tachycardia, and not that cardiologists don't check the boxes and make sure that there's not underlying things, or not even a tachycardia, but let's say you have chest pain. You can write a whole book on chest pain. And in cardiology, their job is to close the cardiac chapter. That's what their job is. And here it's, we're going to look at the whole picture as to all of those different chapters and what could be causing the chest pain, and then work towards, who we have to get to evaluate and check those boxes off, or what can we accomplish and fix? I mean, obviously chest pain is an emergency, but I'm saying like ongoing, just like I'm having this aches and pains, what is it? We are more likely in here to look at, is it anxiety? Is it heartburn? What's your diet like? So holistic to me is, one, we're not going to just throw medications at you. That's the other thing. If you come in and you're having GI complaints, we're going to talk about diet. If you're high cholesterol, we're not just going to say, okay, we're governed to throw a statin at you and we're going to check this box. We're not going to do that. We're going to talk about diet and exercise and see if we can do that. Anything you put in your body has potential for side effects. So if I give you a medication for high cholesterol, for example, the side effects of high cholesterol can be far worse than eating lettuce.